Good morning, good afternoon, and good evening, everybody. Welcome to the CDC Field Epidemiology Training Program webinar series. We are delighted to have you with us today for our August technical webinar. If someone who has the slides can show the slides, that would be great. I think this is Dr. Valerie. As we wait for them, we'll go through our regular content. So field epidemiology training programs, or FETPs, are competency-based training programs that strengthen the epidemiologic capacity of global public health workforce in more than 90 countries globally. FETP fellows and graduates detect and stop outbreaks. They improve surveillance systems, and they strengthen public health programming across both infectious and non-infectious diseases. Every month, we're going to be showcasing a photo from a different FETP on this slide. Today, we are showing a photo from Sierra Leone. We're watching the FETP intermediate trainees conducting a qualitative interview in May of 2024 on a study about knowledge and risk perception on Lassa fever. So congratulations to the Sierra Leone FETP. Really well done. Next slide. CDC's Global Workforce Development Branch has a range of virtual content to support FETPs. These include our monthly global Zoom calls between CDC headquarters and our field FETPs, and two different types of webinar series. These are the quarterly FETP programmatic and soft skills webinar. Note that actually we don't have one tomorrow, that's from last week. And the monthly FETP technical webinar series. So today's webinar is part of our FETP technical webinar series. And for information about any of these, you can always email askgwdb@cdc.gov. Next slide. So today's webinar will be 90 minutes with about an hour and 15 of presentation and about 15 minutes of Q&A. We have live interpretation today in Spanish, French, Portuguese, and Russian. And on the lower part of the screen, in your navigation bar, you can choose your preferred language. We will also, as we normally do, be asking for a very short evaluation of today's webinar. The evaluation is required if you want to receive a certificate of completion, and the link to the evaluation will be on a slide and in the chat box at the very end of the webinar. Next slide. During today's webinar, we want to remind everyone who has questions to please use the chat box instead of to please use the Q&A box and not the chat box. The Q&A button is available on the bottom of your chat screen. If you ask a question in the chat, the presenter may not see it. Next slide. So with that, I would like to introduce today's presenters, Doctors Julia Earl Richardson and Valerie Mack. Dr. Julia serves as a team lead for the Social, Behavioral, and Evaluation Sciences team at CDC. Dr. Julia's background is in epidemiology and behavioral science, and Dr. Valerie's is field epidemiology and nursing. The CDC Excel tool for thematic analysis that Dr. Julia will present today is something that she began working on more than 5 years ago during epidemic response, and their team has collaboratively tested and revised this tool. So with that, I'm going to go ahead and turn it over to Dr. Valerie to start us off. Welcome, Dr. Valerie.
Thank you, Dr. Julie. All right, so the title of today's presentation is Qualitative Data Collection and Analysis for Field Epidemiology. We will be presenting today's webinar in two parts. In part one, we will discuss how to collect qualitative data that is important to field investigators. And in part two, we will provide an introduction for how to analyze text data. Some of you might recall Dr. Julie's webinar last year about using qualitative and descriptive data to complete the outbreak story. In that webinar, she showed a typical case control study about a measles outbreak investigation that gave us odds ratios, but no details. Throughout the presentation, she demonstrated where additional qualitative data could be collected and used to provide the full story of the outbreak, not just the odds ratios. Today, we will return to that scenario to understand how those qualitative data might be collected. First, let's review the scenario from Dr. Julie's webinar. In the presentation last year, she presented a scenario where she asked viewers to imagine that you're a health officer working in a district health office. So let's go back to that time and all imagine ourselves as a health officer working in our district health office. The morning of September 14th, your phone rings. It's the nurse at a medium-sized clinic in your village, in your district. She says, "We've seen several children at our clinic in the last week who have rashes that look like measles. Can you help us investigate?" And she sends you a photo of a child with a rash, which does indeed look like measles. Dr. Julie's presentation about the outbreak described a case control study, and she presented an epidemic curve for the full outbreak. I'm showing that epidemic curve here. On the x-axis are the dates of onset, and on the y-axis are the number of cases. There are arrows to show the dates the investigation began and the dates the vaccination campaign began. The last case in the outbreak had an onset of October 14th, by which time there had been 80 total suspected and confirmed measles cases over 2 months. The learning objective from the previous webinar was to expand the use of descriptive and qualitative data to build outbreak stories during investigations. In the first part of today's webinar, we will go more in depth into the collection of qualitative data and 3 potential sources of qualitative data during investigations. Last year, Dr. Julie summarized an outbreak investigation in this way. Behind every outbreak is a story. There are 2 main parts to that story. In the first part, life is going along normally with either low or no levels of disease. And then something changes. In the second part of the story of an outbreak, a population has to have some factors, which we usually call risk factors, that allow the outbreak to spread or that allow many people to become infected. For those of you who saw the presentation on the measles outbreak, Dr. Julie presented this table showing the odds ratios for different risk factors or those factors associated with measles. We can see in the first few rows that cases had increased odds of having contact with a child with a rash, being at boys' school A before onset, of being male, or visiting water point A before onset. Cases also had a higher odds of controls of having no measles vaccine or only 1 vaccine instead of 2 vaccines. This table shows a lot of very valuable information, but there is more to the outbreak story. For our outbreak story, it is especially important to recognize that both of these elements must be present for an outbreak to occur. That is, something has to change that exposes the population to the pathogen, and there must be risk factors in the population that allow the disease to spread. For example, if a person with measles enters a population and interacts with everyone, but the population has very high rates of vaccination, then there will be no outbreak. Beyond these two parts of the outbreak story, there is often both context and additional details about the outbreak that don't make it into the investigation, but which are equally important. We can use qualitative data to capture context and additional details to help explain what changed to start the outbreak and how the risk factors allowed the spread of the outbreak. The three sources of qualitative data that we typically use in outbreak investigations are field notes, in-depth interviews, and focus groups. We can pull these data sources together for analysis to help us finish our outbreak story. The first qualitative data source that is highly accessible and useful in nearly all investigations is field notes. When utilizing field notes in an investigation, there are two main steps. Step 1, determine your purpose. In the case of our scenario, we are wanting to learn more about what changed in the community to start the measles outbreak. And then, step 2, identify opportunities for observation or note-taking within the existing data collection or community interactions. The notes that you take during the course of an investigation are a great source of qualitative data, and they can be analyzed. Potential opportunities for observations and note-taking include examining case report forms or contact tracing data, chart reviews, and informal conversations or spontaneous interviews. Field notes are collected in a field notebook. They should have key descriptors on each entry. These include your name, time and date of the observations or note-taking. The types of things to include in your field notes are observations of events or sketches, people's stories about events and what happened, the weather, season, pertinent holidays, whether national or cultural, and relevant customs for that holiday, geographic features, transportation, laws and policies, availability or cost of resources, the use of complementary or alternative health modalities, nonverbal communication and other observations, and then information about health knowledge or beliefs that you hear or notice. Here are a few things to keep in mind when developing your field note-taking skills. To help with accurately capturing data, write notes either during or after making observations. Write down keywords or phrases to record as much as you can. Even if they seem irrelevant now, they could be important details for later. If you are having an informal conversation or impromptu interview, it might be more convenient to write notes afterwards to keep your focus on the conversation. Leave space to expand your notes. Because it isn't important that others can interpret your notes, they are for you, and you'll need to write them in a way that records the information quickly while also allowing you to interpret them later. Expanding your notes should be done within 24 hours while the information is fresh in your mind. To expand your notes, you can write them directly into your field notebook. As you're expanding your notes, you can use this time to reflect on additional questions to explore or identify key informants that you might want to interview later on. To finalize your field notes, type them into a computer document. As an option, you can expand your field notes as you type them into a document if that works better for you, rather than expanding them into your field notes, your field notebook. Now, We are back in the measles outbreak scenario. We are with our investigator, Ellie Epi. After reviewing the case report forms, her field notes might look like this. I bet you probably have something like this in your own field notes. We would have our field note description with her name, Ellie Epi, the date of the field note, the description, which is observations from case reports in our case, and the location of where she was when she was collecting these field notes, which is the epidemiology office. Underneath, she has written that the first case is a 9-month-old baby girl who traveled with her mother to an area of a neighboring country experiencing a measles outbreak. She had stayed with her cousin who had symptoms consistent with measles, including a rash and a fever, with an onset of August 13th. Her parents did not seek medical care for her illness, and she had no history of receiving a measles-containing vaccine. Next to that, she has written that the second case, her 8-year-old brother, developed the measles rash almost exactly 2 weeks later on August 26th. He had no travel history and had received one measles-containing vaccine at 1 year of age. He was a student at Boys School A, which he attended until August 28th. After that time, he stayed at home until September 5th. He did not seek medical care either. Once more, let's go back to our epidemic curve. In this step, we are expanding our field notes to summarize what we know up to this point and seeing what questions come up. We can do this as we are typing up our field notes into a computer document. So far, we know that what changed was that measles entered the population through a 9-month-old unvaccinated female who traveled to an area experiencing a measles outbreak. We suspect that she transmitted the infection to her brother, who attended Boys School A and went to school while ill. We also know that neither child received medical care for their illnesses. After that, we know that there was a cluster specifically among older children more than 5 years, and the next group of cases occurred among both older and younger children before the outbreak ended. Here is an example of field notes that Ellie Epi typed up into a computer file that we went over in the previous slide. We have a little bit more information from our field notes, but we don't have the full story yet. Also included here are 2 emerging questions that Ellie included from when she expanded her field notes. For example, why didn't the parents of the first 2 cases seek medical care for their children? And did School A notice the boy's rash? Did they report it? To answer our emerging questions, we can use another qualitative data source. This source is in-depth interviews. This qualitative data source can be used to gather detailed information on an individual's perspective, experiences, feelings, and resulting meaning about a particular topic or issue. Before you begin conducting in-depth interviews, you will need to define what you want to know. We identified emerging questions from our field notes and identify who would have the information that you want. You will also need to choose how to record the interview. It can be audio recorded and then transcribed, or you can rely on your notes from the interview, depending upon the resources you have available. It is also helpful to consider factors that might influence the interview. For instance, like if others are listening to the interview conversation, or if the person you are interviewing is in a hurry. These interviews are really meant to be like a conversation to help keep the conversation focused and gather the information that we want. We need to create an interview guide. We will discuss what that looks like and what that means in a few minutes. And finally, when do you have enough data? In most cases, in-depth interviews during an outbreak investigation, you will be limited by the time you or the person you were interviewing have available, and you will want to use the smallest number of interviews that will provide the information needed. In other situations, you can stop at saturation. This means that you are hearing the same information, over and over again, and no new information is being generated. Here is Ellie Epi, the investigator on your team in our measles scenario. To answer our emerging questions, she is planning a series of in-depth interviews. Here is one of the emerging questions that we want to answer that was generated from your field notes. Why didn't the parents of the first two cases seek medical care? Remember, we found out that from the case reports, the parents of the first case didn't seek medical care when their baby girl developed a rash and a fever. And then, when her brother developed a rash, they didn't seek medical care for him either. This seemed unusual. So, who do you think we need to interview to learn more about this? The parents. Here is the guide that the investigator, Ellie Epi, created in our scenario. This was to help guide the in-depth interview with the parents of the first two cases. It contains an introduction explaining our general purpose and asks for permission to interview. Hi, I'm Ellie Epi, and I work with the District Health Office. I would like to talk with you about your recent experiences with measles. It would require about 15 to 30 minutes of your time. Would that be okay? If you are recording and then transcribing the interview, you would also include that information when asking permission, as well as what you will do with the data after this work is complete. You will need to create non-judgmental prompts or open-ended questions to help open the conversation. To answer the emerging question of why didn't they seek medical care for their children, here are a series of prompts that she created, Ellie Epi, for the in-depth interview with the parents of the first two cases. First, I want to learn more about your experiences with medical providers. What are the types of situations where you would take your child to a medical provider? Another prompt, or part of the series of prompts, would be, what types of providers do you typically go to? For example, a traditional healer or other provider? Slide, we are showing Ellie Epi visiting the parents of the first two cases at their house. To do the in-depth interview, we will be using the interview guide. Ellie Epi does the introduction and then uses the prompt. What types of providers do you typically go to? For example, a traditional healer or other provider? The mother replies, the doctor at the clinic is who we go to. Then Ellie Epi asks, what are the types of situations where you would take your children to a medical provider? The mother explains, when our children are very sick, we take them to the clinic, but it is not easy. Our children often get rashes, and we didn't think that their illness was serious, and we didn't know that others could get it too. The interview continues, and the mother speaks about the difficulties she has experienced with going to the clinic. At the end of the interview, we thank the mother and we head to our next interview. Another type of open-ended question that we can use during an in-depth interview is a probe or probing question. Sometimes in an interview, there will be new information that you weren't expecting. And so you won't have a prompt or open-ended question prepared. So instead, you will continue the interview like you would in a conversation, and you will use a probe, which is a question that gets you more information. We will need to use a probe in this next example. In this slide, we are back in our scenario, and we are at School A, showing Epi in the hallway of School A. On the top, we have a second emerging question that we want to answer that was generated from the field notes. The question is, did School A notice the boy's rash? Did they report it? And to answer this emerging question, who do you need to interview to learn more about this? The teacher from School A. This time, Ellie Epi is using a different guide that she created for interviewing the teacher at School A. After the introduction, she asked the teacher, "What did you notice first about the boy that was sick with measles? Were you worried?" He says, "I did notice the rash, and I even thought maybe it was measles, but I didn't think it was my place to intervene. It is the parents who decide how to manage their children." The teacher also mentions that the boy, the second case, was the water collector for her class this past month. Even though this was not part of your interview guide, you want to probe further to find out more about this information. You weren't anticipating this new information, and so you don't have any prompts prepared in your interview guide, but that's okay. To keep the conversation going, you continue the conversation and use the following probe. How does your school get water from water point A? Success! The teacher replies with some valuable information for your outbreak story, explaining that 3 children from each class are responsible for getting the water for their class each morning for a month. They usually meet before class and get the buckets and bring back and forth the water from water point A until the month is over. This information from the teacher explains why accessing water point A was a common risk factor for measles. Water point A is a common water gathering spot. How many questions do we have? There are always more questions to ask in an outbreak, but there is one that should always be asked when there's an outbreak of a vaccine preventable disease, or VPD, that happens in a country or a community with a vaccine program. This question is, what is going on with the vaccine program in the affected community? This question relates to the second part of our outbreak story, the risk factors that allow the spread of the outbreak. In our scenario, the possible risk factors that we want to explore are the social factors that allow the spread of the outbreak, specifically ones that relate to what is going on with the vaccine program in the affected community. We wonder, is there a vaccine program available? In fact, yes, there is. This is one of the most important parts of your investigation into a vaccine preventable disease. And to answer it, you need to do additional qualitative work. If you have a functional measles vaccination campaign in your country or community, you should generally not have outbreaks of measles. An outbreak of measles always represents a problem with vaccination in one way or another. Some of the reasons the vaccination program might not be working include routine vaccinations are not always available. The vaccine campaigns skip their community sometimes. They don't know that vaccination is important. They don't agree with vaccination, whether this vaccine or all vaccines. Problems with vaccine quality, like cold chain. And so to explore the social factors that allow the spread of the outbreak, which in our case is to understand what is going on with the vaccine program and understand what social factors contributed to the transmission of measles in the community, we can use source 3, focus groups. A focus group is a group of 5 to 9 people with similar experiences who can speak about their views and experiences that relate to your research question. In these next few slides, we will look at strategies to use in focus groups before, during, and after. Going back to our scenario, we want to use focus groups to help our investigation. Before we begin, we need to identify the purpose of the focus groups. In our scenario, we are wanting to explore the social factors that might have played a role in the transmission of measles in the district. Next, we need to determine who can provide the information that we want and decide how many focus groups are needed. The number of different types of individuals will determine the number of focus groups you need. In our case, we need information from the school aid community and the clinic staff from the district, which would be 2 different groups that are important to our investigation. When possible, we want focus groups to be organized by what participants have in common and look for existing groups. For example, we could have a focus group of parents from school A and a separate focus group of teachers from school A. And there might even be an existing parent and an existing teacher group at this school that we could access. For the clinic staff, we might want to have separate groups, one for nurses and medical assistants, and one for doctors and managers. This is because we do not know if there are any power dynamics that could make participants hesitant to share their thoughts. Sometimes we face situations, especially in outbreak responses, where we might have limited resources. In those cases, we could choose to have fewer focus groups. For example, in our scenario, that might mean just having one focus group for the school aid community. Once we have designed our focus groups, we need to develop the moderator guide for the focus group discussion. This is an example that shows the basic parts of a moderator guide that the investigation team and Ellie Epi put together for the parents focus group, the parents and teachers focus group at school aid. The moderator guide was designed with our objective in mind, to explore the social factors that might have played a role in the transmission of measles in the district. The guide will differ between some groups, so customize the guide to the focus group participants. Begin the discussion with an introduction. Welcome the participants and introduce yourself. Explain the purpose of the focus group. Include the risk and benefits, as well as the importance of their input. Let participants know that they can leave the focus group at any time. Include expectations or ground rules within the focus group discussion. These would include respecting the opinions of others and confidentiality. In this case, confidentiality would mean keeping what is said during the discussion private and not sharing that information with others. Start with an icebreaker. Choose one that adds information helpful to your objective and begin the discussion. That will also help to begin the discussion. In our case, we could ask participants to share one thing that they have heard about measles. Next, we will need a series of 4 to 6 discussion prompts that the moderator will use to encourage participants to share their views and experiences about our topic. We will look at some example prompts in the next few minutes. Before that, let's talk about the rest of the moderator guide. During the discussion, you'll want to use follow-up questions and probes to expand the discussion. It can be helpful to write potential follow-up questions and probes that you think you might use during the discussion. During the wrap-up, there will be a summary of key points to allow for any clarifications. At the end of the discussion, you will thank participants and inform them of any follow-up actions that you are planning. And finally, test the question prompts before you have the focus groups. To do this, find a person who is similar to the participants in your upcoming focus group, and you'll want to ask them to tell you, in their own words, what the question prompts are asking about. This helps you to have more confidence that your questions are clear and that your questions are being interpreted as you intend. Change your prompts that aren't clear and test your prompts again. When designing and testing your prompts, consider the order of the prompts, starting with prompts that can generate more discussion towards the beginning, and then go to prompts that lead to more specific information towards the end of your focus group discussion. Here are a few prompts that the team developed for the focus group discussion with the parents around School A. For example, a prompt for understanding the level of knowledge and awareness about measles. Here is an example prompt. What things have you learned about measles during the recent outbreak? Anyone can start. To help facilitate discussion about barriers to vaccination, you might use a prompt like this. Let's talk about your experiences with accessing the district's vaccination services. What has that been like for you? Your team was able to reserve the schoolyard for the focus group. To do the focus group discussion, you'll need 3 roles. First, you'll need a moderator. This role is to lead the discussion based on the focus group guide. The moderator will look for opportunities to involve different participants and keep the discussion on topic. You will also need a note taker. This role is to support the moderator in the discussion and write detailed notes, including nonverbal observations during the discussion, and you will also need a technician. The technician will be responsible for checking in participants, handling consent documents, and auto-recording the focus group discussion. Here are a few tips to help during the focus group. Typically, you will need around 60 minutes with your participants, but no more than 90 minutes for your focus group discussion. Provide name tags to participants, and set up the area so that participants and staff can sit in a circle facing each other, if that's possible. Check on your agency's policy about compensation for participants, as well as any support available, like refreshments or childcare. And do try to ask one question at a time. It is fine to use pauses because participants might not respond to prompts immediately, and it can be helpful to pause just for a few moments to allow space for participants to think and respond. Also, try to use neutral responses when acknowledging your participants and what they are saying in the discussion. After the focus group has ended, use the notes from the note taker and debrief immediately afterwards. During the debrief, similar to the process with field notes, expand the focus group notes that were written by the note taker. Include initial thoughts about main themes that emerged, things that were unclear or different from previous findings, or things that are different that you've heard from in previous focus groups, any additional nonverbal observations that were noticed by your team, and any issues that need to be resolved, perhaps before the next focus group. To finalize our focus group data, the last thing we need to do is convert the focus group discussion to text data. To do this, type up the focus group notes and place them into a computer document. You will also need to just transcribe the focus group audio recording into a computer document as well. Now that we have qualitative data from 3 different sources, field notes, in-depth interviews, and focus groups, we can pool these data sources together for analysis to help finish our outbreak story. Here is some information about a great resource regarding collecting qualitative data. This is a reference that we use to help inform some of the information that was presented in part 1 of today's seminar. Next up, we have part 2 of today's seminar with Dr. Julia. Now I'm going to end my sharing of the slideshow and hand it over to Dr. Julia. Dr. Julia will be presenting her slides in a moment.
Thank you, Dr. Valerie. I'm just trying to, I'm not allowed to share yet, so I'm waiting for it to allow me to share.
Yeah, Val, I think you have to stop sharing.
Be at the
Oh.
top of,
While we wait, guys, there's still more to come, so just hang tight. Bill, are you able to stop sharing? I see lots and lots of comments in the chat. Great presentation. You made this easier. So insightful. Congratulations, Dr. Valerie. Great presentation. So really wonderful. Thanks so much, Dr. Val. That has really demystified a lot of the qualitative data for us. And we'll go back to Dr. Julia. Thanks.
Thank you, Dr. Julie. Can you see my slides?
We sure can.
All right. Ready to go. I just need to find the advance button here. Well, hello, everyone. It's really a pleasure to be speaking with you today. For the rest of the webinar, I'm going to be talking about starting your qualitative analysis. I've got to figure out forward. Sorry for a minute. I just have to find something that will make this go forward. Here we go. Okay. So qualitative analysis is a way to analyze text data to help us answer an important question. And in Dr. Valerie's part of the webinar, she demonstrated 3 types of data collection and the data that each one produced. Case investigation field notes, transcript of an in-depth interview with the mother of the first case, and a transcript of a focus group with parents from school A. We're going to learn about qualitative data analysis, which is a way you can analyze text data like this. Whoops. We want to know what social factors may have contributed to the transmission in this community. And what we mean by social factors are family traditions and relationships, school environment and policies, community norms and services, or the healthcare system's relationship with the community. Those are all social factors that might affect the outbreak. So let's start by talking about what text data is and how it's different from statistical data. Here, I'm showing a table with statistical data, and in it, we see factors related to measles from a case control study. Dr. Valerie showed this earlier today. This table is very useful because it presents important information about our measles outbreak in a clear and organized way. On the right, we also have information about the measles outbreak. It's a different kind of information, and it's somewhat hidden in the paragraph. We have to go find it. The yellow highlighted sections are important pieces of information about things that may have contributed to the measles outbreak. These 4 segments are: a 9-month-old unvaccinated female, traveled to an area experiencing a measles outbreak, did not receive medical care, and brother's vaccine history indicated 1 dose of vaccine. All of these statements can be related to increased transmission of measles. So you can see how answers to our questions can be hidden in the text. Not all of the paragraph is useful. The important parts of the paragraph that we have highlighted in yellow are called text segments. So text data is information in paragraphs. And we don't often think of a paragraph as data, but it is. It contains a lot of important information. However, working with a paragraph can be challenging, so we use qualitative analysis to organize the text, making it easier to identify the important data within it. We want to take the useful parts out of the paragraph, and we do this using text coding. So what is text coding? As I said before, not all of the paragraph is useful. We want to pull out and organize just the parts that help us answer our question. This slide shows the beginning of the text from our field notes from Dr. Valerie's presentation and what it might look like if we text coded it. So now we have the same paragraph with several important statements highlighted. And in addition to that, we are adding to each highlighted statement, which we call a text segment, a brief description of the meaning of that text segment. These are called text codes. For example, the text segment, a 9-month-old unvaccinated female, is coded as unvaccinated. The next text segment, traveled to an area experiencing a measles outbreak, is coded as previous travel to an outbreak area. So you can see that these are shorter, simpler ways of describing what's in the text segment. So text coding, we can say, is picking the important parts of the paragraph and attaching a title or a code to it. There are some key points that you should know about text codes. Codes identify the important points in your text. They briefly describe the text meaning. They should be short, with using as few words as possible to convey the idea clearly. A good code is short and clear, but at the same time, it's meant to be used several times. So you want it to be broad enough that you can code several different text segments with it. So you have to get a balance between being brief and clear, but being broad enough so you may use it more than once. You may choose not to code a text segment if it doesn't relate to your research question. And last, it's important to know that different people may think different text segments are important. No 2 people will probably code the same paragraph the same way. However, you can review each other's coding and come to agreement. So how do we use codes in qualitative analysis? There are 2 steps. First, we group the important text segments according to code. We put each text segment underneath its code along with any other text segments that have the same code. You can see on the slide that I have listed the 2 segments, she did not receive medical care and he did not receive medical care, under the same code, untreated illness, because they both were coded that way. With a longer text, you would probably find 8 or 9 different text segments under each of these. And this is a way of organizing the important points under your brief explanation of why they're important. Next, we've grouped similar codes together to find patterns. This time, I have modified this code a little. Originally, it was unvaccinated. I changed it to not fully vaccinated, so I broadened it slightly. And that way, I can fit 2 very closely related text segments together. 9-month-old unvaccinated female and brother's vaccine history indicated 1 dose. So effectively, neither of these 2 individuals were appropriately vaccinated. Also, the codes not fully vaccinated and untreated illness seem somewhat similar to me because they both relate to families not fully utilizing the health services. Even though the codes and the text segments are different, they relate to something maybe similar. Maybe they're both coming from the fact that the parents are not well connected to the health system. This is a pattern that I see, and these patterns are called themes. Because they're similar and they seem to fit into a theme, I moved them next to each other and I put the theme to
Julia, I think we might have lost you.
have contributed to the transmission of measles. So we think about this theme. Are parents not being well connected to the healthcare system? Does that seem to relate to disease transmission? Well, we can see as we look at these factors related here, all of this certainly does relate to the social factor of not having good support and good communication with the healthcare system. So we can be assured that our theme does relate to our question, and it's worth keeping it in our A theme is a statement about what may be happening amongst the population that you are studying. It is built based on text segments and codes. You can look at your text segments and codes and see why you made that theme. And someone else can see it too. They can decide whether they agree with you after they look at the text codes and the themes. As we said, it starts to answer your research question. A theme doesn't provide the whole answer, but it tells you about the social factors that you see in the text that relate to your question. As you get more and more themes, it paints a picture of what may be going on. So let's pull that all together for a clear summary of what qualitative analysis is. We use text data, which is basically paragraphs or pages of words where important information is hidden. We use text coding, which is identifying the important sentences or phrases. We also call them text segments, and giving each one a name that identifies briefly what is important about it. Thematic analysis is when you pull similar codes together and then look for patterns that help you answer your research question. And themes are statements that represent the patterns you see, which also help you answer your question. Now that we understand that qualitative analysis is a method for organizing text to answer our questions, I will show you a tool we have created to make your qualitative analysis easier. At the end of this webinar, we will put this tool in the chat along with 3 text files from our measles scenario. You can open the file and look at what we did today. This slide displays the first worksheet in our Excel tool for thematic analysis. Thematic analysis is another term for the type of qualitative analysis we do, where we create themes. Other people may use different methods for qualitative analysis. This slide shows the first worksheet, which is the table of contents. You can see that the tool is divided into 3 sections. The blue section is the setup section, and there are listed 5 worksheets underneath that are part of the setup. The green section is for coding text segments, and it has 3 worksheets. And then the yellow section is the thematic analysis section that has 3 worksheets. And each one of these has a corresponding color for the worksheets across the bottom. Right, wrong way. This just shows how these worksheets work. If you click on any of these worksheets, it will open going across the bottom. And I'm going to be showing today the blue worksheets. And this includes our coding scheme for measles. I'm not expecting you to understand how these all work at this point. I just want to demonstrate this so you can see from the Start Work page, you can go to any of the worksheets from clicking on the bottom. Now I'll guide you through the first 5 worksheets. These worksheets are part of the setup phase of the qualitative analysis. They include planning the inquiry, organizing transcripts and notes, selecting the coding scheme, and we have 3 that you can choose from, typically epidemics, other health emergencies, and the design your own. This is where I've put the measles coding scheme for you. Then viewing and editing the coding scheme. And number 5 is importing text into the coding scheme. The other 2 parts, coding and thematic analysis, will be covered in our next webinar. So let's get started. The first step in analyzing text data is planning the inquiry. But before we go into this worksheet, I want to talk about what we mean by inquiry, because it may be a little different than what you're used to. In formal research, you would always do your planning, which is formulating your question, selecting a study design, planning your data collection, and so on, well before you collect your data. However, for this tool, we're defining inquiry a little bit differently. In this worksheet, you're asked to state your research question and explain why it's worth answering, who would use the results, and how those results would help address measles. This may sound a bit simple, but we've found over the years that qualitative analysis is very unlikely to be successful unless it includes a very clear statement of purpose. If it's easier for you to think of it this way, I suggest in your mind you call this worksheet the statement of purpose. So to get us started, I've entered the question into the first column of the planning tool. And again, our question is, what social factors may have contributed to the transmission of measles? Next, we asked ourselves, how will this knowledge be used for action? And here we're asked to list uses for the information. So once we've answered our questions, what would we do with it? If you can't answer this question, you should really think hard about why are you doing it. I've identified some possible uses for answering the question about social factors in measles. Perhaps you would use whatever you learned if part of the problem was lack of public awareness to increase awareness through public alerts. If what you find is problems with the vaccination program, maybe you would suggest program changes for the vaccination program. Or there may be some other issues that are identified that the public would collaborate with to address. Next, the planning sheet asks you to think about who would need to be involved in these actions. So for the public alerts, we're talking about local health officials, maybe the radio station. For changes to the vaccine program, of course, it would need to be led by the folks in the vaccine program. And then for public collaboration to reduce measles, it could be any kind of group in your community that's interested and concerned about measles. That could include clinics, religious institutions, civics groups, schools, shops, and probably several other groups in the community. Last, we want to think about whether they're ready to receive this knowledge. And what this really means is you should describe the communication with these groups that you've already had. Is this something that they're asking you for? Is this something they're not aware of at all? Is this something you're going to need to approach them and introduce the topic for? So in my imagination, I'm going to say maybe, I mean, you're a local health official, but maybe the radio station isn't aware of it, but they'd be open to sharing the information. Perhaps the vaccination program knows that there's a problem and they've asked you to look around and see what information you've given them, so they're ready to hear about it. And then lastly, maybe the community groups are not aware, and that's going to stimulate you to reach out to some of them and see if you can get their participation and interest. Now we've covered the first step from the CDC Excel tool, planning the inquiry, and we have our sheet all filled out. Our next step is to organize the transcripts and notes that we have collected. This is the third tab at the bottom. I'm sorry, number 2, but it is the third tab at the bottom. This is the transcript log sheet. It's used to organize our notes and transcript files. Across the top, you will see different attributes for each file, such as ID number, the date it was collected, the type of data collection, the number of participants involved, if it was an activity that involved participants, like a focus group, the name of the file, and then whether that file has been formatted for your importation and whether you've completed the coding. It also indicates what type of participant. Again, if it's something like a focus group or interview, you put the demographic characteristic of the participants there. This log sheet does 2 things. First, it allows you to keep track of how many different text data files you have and what kinds of data collections you have done. For example, if you have done several focus groups and interviews, but aren't sure if you have all of the groups represented that you need, this list can help you review what you have and what you might still need to collect. Second, all of the information that you enter here will automatically link with the coded text when you do your coding, so that every coded text segment will have the name of the file, the date of the collection, and all the other information recorded here with it. And so we'll see in the future webinar that you can sort any of your themes or codes using these variables. Now, what you're seeing here on the slide is just the example that comes with the tool. I'm going to delete that and just walk you through what entering our information would look like. So let's imagine our field notes were collected on October 6th. I'm going to write field notes for the type of thing that it is. It's notes rather than a transcript. There were not really any participants. That's more for focus groups. We're going to give the file name field notes. You could name your file whatever you like. And this far in our process, we have not formatted it for importation, but I'll show you that in a minute. And we have not coded it. And for this, again, there aren't participants, so we'll put none. And for the other 2 types of data collection that we did, I'm going to just paste them in quickly so you can see what the completed sheet looks like. So we don't have to take too much time doing this. So this is what our completed sheet looks like. And once I refresh it, you'll see that it also keeps track of the number of transcripts or notes that you have and the total number of participants and how you're doing on getting your work done with formatting and coding. Now that we've filled out the worksheet, organizing transcripts and notes, let's look at selecting the coding scheme. But this is a good moment I'm having trouble advancing. This is a good moment to stop and talk about what is a coding scheme. We've talked about text codes, but now I want to introduce the idea of a coding scheme. A coding scheme is a list of codes to choose from while you're coding. You might want to start your coding with just inventing some descriptors like we did in the earlier example. But, but before long, it'll be important to create a list of codes that you use over and over again. The reason this is important is remember how we grouped the text segments together by code. You don't want to have a different code for every single text segment, or you won't be able to do any grouping. You want to be able to put similar text codes together that represent similar text segments. So an important feature of the Excel tool is we've put the coding scheme in the worksheet. So it'll be really easy for you to do your coding as quickly as possible. We're going to give you a copy of the Excel tool at the end of today's webinar that has the measles coding scheme in it and the other things today that we did so you can explore the tool. So I have an example here that shows a little bit more about how our coding scheme uses two levels of coding. Remember our text segment, he remained at school while symptomatic. We're going to give that both a broad code, which is a kind of broad topic, which is school, and then a very specific code, a sick children at school. And you can see this little segment here is our the part of our coding scheme that talks about the school environment. And you can see that there's one broad code, school environment, and then several specific codes. And here is sick children at school. So the coding schemes that we use in the Excel tool always have two levels because over the years we found that it's easier for reasons we'll see in the next webinar. It's easier to code when you have a two-level tool. And it's also helpful in the long run if you want to group things either broadly or very specifically. Okay. So going back to our pulling it all together slide, we can now add a part to our summary about text coding. That for our purposes, using the Excel tool, text coding includes a broad code and a specific code. So we now know it will be a two-step process. So here are the broad codes for our measles investigation coding scheme. Keep in mind that the coding scheme needs to relate to your research question. This is because the codes are what you will use to help you find the information hidden in the paragraphs of text that are important for answering your research question. So these are the broad codes, and they should look familiar based on what we've seen so far in the webinar. Measles characteristics, child characteristics, family environment, school environment, community environment, medical diagnosis and care, vaccination, and public health communication. And I always include one for other because there may be other things that you want to keep in your analysis that you didn't think of ahead of time. And you can see these all relate to our initial research question. Now here is a slide that shows the whole coding scheme. So you can see each one of the broad codes that we talked about, and then several specific codes. And this can be added to. I'm actually still developing some of the specific codes as I work through the text. But you want to have a pretty clear set coding scheme and make small additions and changes as you go. Back to in the Excel tool, the tool asks us to select a coding scheme. Normally, you have to choose between the epidemic coding scheme, which is used for community feedback during a large epidemic, a community, that's A. B, other health emergencies, which is a similar type of community feedback coding tool for other natural disasters. and then C, a blank coding scheme where you design your own. However, for this webinar, I've gone ahead and loaded our measles investigation coding scheme into the C, design your own location in the worksheet. We'll be using this in the next webinar. Let's take a look. Okay, whoops, back up one. Okay, so this is the choose your coding scheme worksheet. When you click on 4, whoops, I'm sorry, I'm having trouble with the animation here. When you click on the select your coding scheme worksheet, you'll see these 3 buttons. We'll be clicking on the measles investigation worksheet, and it brings you to the coding scheme worksheet. Now, this is a worksheet where Excel stores your codes. And this is also the place where you can make additions and changes to your code as you decide that you need to. I want to show you, even though we're not doing coding today, what the coding mechanism looks like, because I think it makes all of the planning a little bit easier when you can see how the broad code and the specific code gets assigned in the tool. This is the kind of coding that we're going to be doing in the next webinar. So you look at your text segment, and then you decide what broad code it goes under. And then after you do that, that choice reveals the specific codes that relate to that coding scheme. Once we select our measles coding scheme, we can go back anytime we like and make more edits. You can fill in blanks here in the specific coding schemes, or you can even type over ones if you decide you want to change it. However, at this point, I wouldn't recommend changing the broad coding schemes. That requires more programming, and it's an advanced part of using the Excel tool. We do cover it in YouTube tutorials that we have made, which we'll be sharing at the end of the webinar. But for now, we're going to limit ourselves to making additions and changes only to the specific codes underneath the broad coding schemes. The last part of the setup is to import your text into the tool. For this example, we are assuming that you have each of our 3 texts in a separate Word document, and it can be any kind of a text format. You will remember from Dr. Valerie's talk that we have 3 kinds of qualitative data. We have case investigation field notes, in-depth interview transcript from the interview of the mother of the first case, and a focus group transcript from the school A parents. We need to pull these 3 data sources together for analysis to help us answer our question about what possible additional factors may have contributed to measles transmission in the community. When you use the tool, it's really your choice. You could analyze all 3 of these together. You could analyze one by itself. For our measles example, we're going to use all 3. This is our field notes text in a word processing file. While loading the text into the tool is a simple matter of copying and pasting, we do have to take one formatting step first. You'll see here that I'm going through the paragraph, and at the end of each sentence, I'm hitting the return button. This puts every sentence on its own line and makes it easier to load into the Excel tool on the text coding page. Once I've finished doing this, I'm going to show you the pasting part of it. So now we select all of the text that we want to import. We copy it. Then we go into the coding workspace, which is a new worksheet you haven't seen yet. And we paste that text into the text sentences column. I like to go up to the top and wrap the text because I think it's easier to read, but that's your choice. And you can see now that I'm putting the file ID for this text from the field notes that was back from our transcript log sheet. It was file number 1. I'm putting the numbers in next to each line of text, and then that makes the name of the file and the participant type appear in the coding workspace. Here's some of the text from the in-depth interview. There is a trick for formatting your text more quickly, which I'll show you now, and this can be really useful if your text is very long. Here, I've gone ahead and selected the whole text, and then I've gone up to the top and picked Replace. In the Find What box, you've just put a period, and in the Replace With box, you put a period, an upward arrow, and a small p, which represents adding a carriage return. And this just goes through and adds an enter or carriage return after the end of each period, after the end of each sentence. Now I've gone ahead again and copied it just like I did before and pasted it into the text sentences column, wrapped the text, but now we're going to put file number 2 because this is from the interview. And again, we can just paste these down, and it connects these text segments that we're going to code in the next webinar to all of the file information that we've already entered. You may encounter a few empty spaces, empty rows in this, and you can just delete them. So that's the end of the setup part. Now you should be ready to try out the tool, which we'll be putting in the chat along with our other 3 text sets. You can select our partially built coding scheme for measles and add some specific codes if you want to the coding scheme. You can even try doing some coding. On this slide, I'm showing you the YouTube tutorials available to help you learn how to use the Excel tool for thematic analysis on your own. You can watch these tutorials after today's webinar to review the setup phase of the tool. And you can also view the tutorials for the coding and thematic analysis sections. There are a total of 9 tutorials, and each one is less than 10 minutes long. If you want to review what you learned today and explore further, I encourage you to visit this site. We'll post the link in the chat. So that is the end of part 2, and now I'm going to turn it back over to Julie so we can talk about some questions. Thank you very much.
Wonderful. Thank you so much, Dr. Julia and Dr. Val, for that very, very interesting presentation. For the folks who are asking questions in the chat, you will get a certificate. If you can keep sharing, Julia, that would be great. Sharing your slides.
Oh, sure.
Thanks. So for the folks who are asking, on the TEFINET website, you will be able to access these slides. You will get a certificate after you fill out the evaluation at the end. So you do need to stay to the end to get that. And we'll go through, we have about 6 or 7 minutes for questions, and the rest of the questions, Dr. Julia and Dr. Val will answer by email. So let's look at a couple of these great questions. One question from Mchunu is, in a scenario where the interviewees are not forthcoming with the information, what is the best thing that you can do?
All right, I can take that question, and perhaps Dr. Julie will also have things to add as well. So in a situation where interviewees for your in-depth interviews who aren't as forthcoming or able to give you the information very quickly, what's the best thing that you can do? The first thing I would recommend is having those who live in the community and are familiar with the community do the in-depth interview. So as if it's someone that already has a relationship and rapport with the community, that can be helpful. If you are that person who has that relationship and the person getting interviewed is still not very comfortable speaking with you, I would recommend talking a little bit more about why the information will be helpful for you, talk about that you will not be sharing the information as far as sharing their personal details with others. If that's something you're able to do, you could also explain, a little bit more about what's going on with an outbreak. Like in our scenario, you could talk a little bit more about measles. You could maybe even say, are there any questions that you have about what's been going on with measles in the community? So, I would just try to open up the conversation a bit more, spend some time telling them why the information is important and why you would love to talk with them. But then, if they're just not comfortable, it's okay to, thank them for their time and then leave your information. If perhaps they decide to contact you later after they've thought about it or talked with someone else. That's kind of the main things I would think about. Dr. Julia, is there anything that you would add?
I was going to say what the last thing that you said. I think it's super important if someone's uncomfortable to give them as much information about why you're doing it and then maybe back off and give them some time. I think a lot of times people will trust you more if they really believe that when you said they don't have to answer something. So give them a little time and a little space to think about it and maybe reapproach them when their little time has gone by.
Yeah, great, guys. Thanks. And if Valerie or Julia, if you can share the YouTube link in the chat, I'm not able to access it. That would be great, and that will allow people to see that video. Another really good question is whether or not it's necessary to use all three types of qualitative data collection. So do you have to do the focus groups and all the others, or can you just use one or two of them?
I can start with an answer since it was about part one. So really, when you're doing an investigation for an outbreak or any other type of epidemiological investigation, you get to choose, based on what you have available and your time. So if it's helpful for you to use all three sources, then wonderful. If you don't have all the time that you need to use all three, you could just use one. You could just use your field notes. You could just use your in-depth interviews. But a big advantage of being able to use the focus groups, you might have noticed in the presentation, is that you might be able to get a little bit more information, really explore things further. So it's really based on what your needs are and what you're able to do during your investigation. But it is flexible and there's no requirement that you have to use all three.
Great.
Totally agree.
So we have a question about the Excel tool. Is the Excel tool for outbreaks alone, or can it be used for any health events? And can it be modified for non-outbreak health conditions like NCDs or that type of thing?
Ooh, I love that question. I'll take that one. No, it absolutely can be modified to use for different types of situations. When you look at it, it seems very oriented towards outbreaks because that's how it was developed for Ebola and then COVID and several other situations. And it particularly filled a need of being able to do qualitative analysis in a very transparent way, but also fast. But no, you can use it for any number of types of health issues, and that's why we put the blank coding scheme in there, so you could develop for whatever you like. And we'd be happy to help if you have something that's quite different and you'd like some assistance.
Super, thanks. And guys, I just posted that YouTube link in the chat. So if you need it, please go ahead and find it there. I think we have time for one more question. Let's see. So somebody had said, what do we mean by using neutral responses to respond to the participants?
So I think this question refers to the focus group part of part one. And so the question about using neutral responses, what I was meaning is that if the moderator is in the focus group and their responsibility is to keep the discussion going, but also not to bias or sway the discussion one way or another, neutral responses would be not saying something that would make the participant feel one way or another about their response, whether discourage them or encourage them, because we'd want to have participants feel comfortable to express their views in the focus group, and we wouldn't want to be pushing participants one way or the other. So it's just a way of saying that we want to keep the conversation going in the discussion, but not really express affirmation or that we don't like anyone's response. Dr. Julia, do you have anything to add?
Let me give a quick example because it's a really
Thanks.
important point and a great question. Let's imagine you were in a focus group and somebody said, I don't trust vaccines because I think they could be harmful. And you're trying to be nice and encourage people to talk, and you might, without thinking about it, say, well, I think that's a really good point. And if you say it like that, the person's going to feel like maybe you agree, the people in the room will feel like maybe you personally agree that vaccines are bad. And so the person next to them who was about to say something positive about vaccine is going to be uncomfortable. So even though you want to encourage people and be nice and, say thank you for speaking, you don't want them to get the idea that you're fishing around for certain kinds of answers. Hope that's helpful.
Yeah, these are great. So guys, I think this is probably all the Q&A we have time for. We have a couple more slides. So please stay tuned so you can get the evaluation link. So if we can go to the subsequent slides, Julia.
Yes.
Okay, can we go, okay, can we go back one? I'm sorry.
Okay, yes.
Oh, yes, okay, go ahead to the, yeah, so to this slide. So, sorry, I don't know which one of these is.
Okay, I do. The
Okay.
one, I think the difference is that the one on the left is the JPEG file, and the one on the right is a PNG.
Ah, gotcha. Okay. Okay, so guys, if you want to get credit for this course, you can take a picture of this. We'll leave this up for just a minute so that you can make sure that you are able to fill out the evaluation and get credit. And of course, this will be out in an email as well, so don't stress if you don't get it right now. We can go ahead to the next slide. Okay, so we have a couple upcoming FETP webinars. You are going to get to hear Dr. Valerie and Dr. Julia and their colleague again on August 20th, when they are going to be showing qualitative data collection during an outbreak, part 2. And this is going to continue with the tool that Dr. Julia introduced. And we did share that tool several times in the chat, as well as the YouTube video, so that you can find out how to use it and practice it on your own. On September 3rd, we're going to have Healthcare Worker Performance Improvement webinar, and this relates to your QI projects. How do we get our healthcare workers to perform better, to improve our health system? And then on September 17th, we will have a webinar on informatics and data visualizations for field epidemiology. So please make sure if you're interested in these that you stay tuned. Next slide. If you want your FETP to be featured in the next technical webinar, you can send us a picture of them. You can send that to askgwdb@cdc.gov, and one photo will be selected for the intro slides for the next webinar. Thank you so much. We can go to the next slide. Oh, I guess that's it. So I want to say thank you again to our excellent presenters, Dr. Julia and Dr. Val. And we're really looking forward to the next part of this webinar. So I'm gonna put these in the chat one more time so you guys can download them. And thanks a lot, and we hope you guys have a great rest of your day. Take care.
Here.